McGovern, and thanks for convening this excellent discussion. And I want to express my appreciation to the panelists for their really terrific contributions. My congressional district in Maryland is in certainly the top 25% of congressional districts in terms of wealth in Montgomery County, Maryland, and Frederick County, and Carroll County. But I've been very focused on this issue, and we've seen some terrible outbreaks of hunger and poverty over the course of the COVID epidemic. And one way of seeing it is with a group that I've worked with for a long time called Adventist Community Services of Greater Washington, which is not far from my house. They basically went, during the course of the first several months of the crisis, they started serving 10 times the number of people as they had seen a year before. And then whole new groups arose. In our school area, we call it the Tacoma Park Middle School Cluster, a new food support group was founded by my friend Wendy Kent. They started by serving 33 families a month, and they went to serving thousands of meals a month because the demand was so overwhelming, with people skipping meals and not able to feed their families, nutritious lunch and dinner. So it's a serious problem, even in areas that sound to you like they might not have a problem, like Montgomery County, Maryland. The question that I want to ask, given this amazing outpouring of human compassion and solidarity that we saw, not just in Montgomery County, but in Frederick County and Carroll County and throughout, is whether we should continue to depend on that. In other words, do we want to work with and mobilize these networks that have formed in our area around school clusters, or is that a manifestation of the failure of our broader food systems and failure of the government? So I'm just curious as to how you integrate the emergence in civil society of efforts to transfer, grocery gift cards and canned goods and fruits and vegetables from farmers market directly to people who are hungry, versus trying to think of it as a more systemic issue. And I don't know, Dr. Schanzenbach, maybe we could start with you.
Yeah, great questions, and it was certainly heartening to see just the overwhelming response, when need surged so much. I do think that we'll want to continue to nurture these networks, but the expectation and hope is that as the economy continues to improve, as we sort of fix some of the shortcomings of SNAP, just the pressure will be taken off of those. And so then we can, really turn to thinking about some of the more, fundamental causes of, why you're having trouble making ends meet. What can we do sort of, to be more sustainable here? But I do think, of course, we want local organizations, we want grassroots people to be part of the solution. I think we're going to need them to be part of the solution.
Yeah.
But they're going to be better on top of SNAP.
Well, and Ms. Curry, I wonder if you would reflect for a moment about the dynamics of the kinds of things that have happened in my community, and I'm sure it's not unique across the country. It's wonderful to be part of food drives where people are bringing food, people are bringing canned goods, people are contributing money. Then there have been like drive-throughs where people come up, we hand them bags of groceries and so on. Is that ultimately what anti-hunger initiatives should look like in America, or do we want something that is more systemic and more structural and more sustained to be taking place? And what are the dynamics in terms of how people feel about it, both the people who participate in giving and the people who participate in receiving? Is it better to have that kind of face-to-face thing? Is it embarrassing? I'm just curious.
Right. I definitely think that programs like ours and many others should definitely continue going forward. with the added benefit of the strengthened SNAP program. But I would say I haven't seen embarrassment, as you said. I've seen more graciousness and gratefulness from family perspective, especially during this time. And what happened here was a pandemic. So we had to do what we had to do and get things to people the way that we needed to get them as fast as we could. And so that model really worked for us. And with our partnership with the World Central Kitchen, who has implemented this same program in many different places, it just works. And it has that back end benefit of helping the hospitality industry as well. And so that part of things has been really great structurally. But I think systemically, absolutely, it would make more sense to have more structure there. But I think that there's a world where both things can live, because we're not going to, until we see this completely end, I feel like we're going to need all of the help that we can get, and then some. And when this pandemic ends, we're not going to see, unfortunately, this go away right away. If anything, I think it'll get worse, a little bit worse before it gets better, because we'll be in that rebuild stage. So I think it's really important to have, strong forces behind the hunger initiative to make sure that we're taking care of everyone until we get to a place where we know that the SNAP and WIC programs that are put into place are truly working. If that answers your question.
I want to thank you for what all of you are doing. I want to thank Adventist Community Services in my area, and I want to thank Wendy Kent from the Tacoma Park Middle School Food Support Cluster, and I want to thank everybody who has stepped up at this moment. Let's just hope that we will be able, through these different legislative initiatives, to strengthen the overall resiliency of our nutrition network in the country. I go back to Mr. Chairman.
Thank you very much. I want to ask unanimous consent to